Mecosta County Medical Center 20 years is what I heard?
Yes, I started in January of 1993.
Okay. All right. And so when you came here, what was the kind of perception of the hospital amongst the community members? And I've kind of heard, at that time it wasn't very good.
Well, I can't really say prior to coming here because I came from out of state, moved my family here and relocated here. I think the charge for me when I came here was to take a really hard look and see what it's a little bit like maybe what Spectrum's done in its due diligence. It's only, again, going to another level, but it was what services didn't we have that we needed, what areas needed to be renovated and beefed up, what types of physicians were needed in the community, etc. Give you a couple of examples. We had several projects that we thought we could do. We couldn't afford more than one at that particular time, but we decided to create a new birthing center. And at the time, probably no one even remembers this now, we were going to put a family practice care office above the birthing center, but at the 11th hour we decided to put inpatient physical rehab because there wasn't one in about a 50-mile radius. Mary Freebed was the only one in Grand Rapids. So we opened up a 12-bed unit on top of the birthing center. We expanded the birthing center to include what they call LDRP rooms, labor, delivery, recovery, and postpartum. Individual rooms where you had a shower, and I call it one-stop shopping for a mom, where the family could come in and be part of that. One of our reasonings for that is because other units, for example, Reed City was considering whether to stay in the OB business, so was Lakeview. Since then, we now know both closed their units because of expense, etc. And so then this was an opportunity for us to capture the OB market, so to speak. If you can capture that market, then you're going to capture the moms and the parents and the small children in the pediatric practice, and maybe they'll grow up here and want to continue their healthcare journey here. So it gave us a bit of an infrastructure to build on everything else. Following that, we knew we needed more primary care physicians. So we went out and started recruiting physicians to build the primary care base. Then we needed a place to put those physicians. We built the medical arts building, and we had a request from Canadian Lakes for additional primary care there. So we built a new building in Canadian Lakes, and you can kind of see over the years we started to grow. And I've always said, and I still maintain this to this day, the secret to healthcare is a primary care infrastructure. If you've got plenty of family practitioners, internal medicines, OBs, pediatricians to take care of the basic needs of a family, then you can attract the specialist and you'll have the patient base, etc. We had hit a point here, and I'm going back to your original question. Okay. What were the issues that you saw at that time? We needed to build the primary care infrastructure here. There was no question. So we've been very fortunate in recruiting new family practitioners. I could kind of go into a long litany about all of them. We tried to find people that had roots here. I'll use the Fosters as a good example. They grew up in Blanchard. They went to Montebello High School. They went to Michigan State. They trained in Grand Rapids. And here they are in Big Rapids, and they're around family. We looked at a lot of practitioners like that we could get to have roots and we knew would remain. We didn't want a revolving door of practitioners. Yeah. Building the medical arts building was a part of that as well. So I didn't look at it like there were insurmountable problems. I looked at it more as, okay, what are the biggest issues and concerns? We got to start someplace, so let's build a new OB. Let's recruit physicians. Once that was done, then we said, what are the biggest needs at that point? We needed a new ER. We needed a new surgical area. We needed to reconstruct our front entrance to let the community know we're alive and well. It's a quality hospital. We have plenty of physicians, good services. Come here and give us a shot. Quite honestly, I've said this forever. The turning point in the history of this hospital was the ER-OR project. That happened in 2005 when we opened up. And to this day, if you come through the front entrance, it looks brand new.
Mm-hmm.
There's 18 emergency room bays. We were in a corner, so to speak, in the old days, and it looks modern. It's high quality. It's clean. It gives a presence of quality health care, and it allows us to attract and recruit physicians. So it's all come together over that period of time. I think, again, we've just kind of gone to another level, year after year, and I look at the merger as probably going to that next level now with healthcare reform.
Okay. And then you touched on a couple of things I wanted to ask about. One being some of the goals that you set when you first arrived. Were those them, or were there any other additional goals that you set when you came here?
That's a great question. I don't. First of all, I can't remember back to 1993. Yeah. I think in simple terms, and that's again the way I try to approach things, just to make the hospital the best it could possibly be here forever and a day for this community, change the perception to where people in the community were proud of their local hospital, wanted to come here for their care. At the same time, the other side of that is in our recruitment of physicians is, recruit physicians that have local roots, but also get involved in the community. So there's a sense of loyalty and community as well. And I think we've done that. I feel good about how far we've come over a period of years. We've. I think when I came here, we had 300 employees. We have 550 now.
Wow.
Home health didn't exist. The medical arts building didn't exist. We didn't have a practice in Canadian Lakes. The birthing center didn't exist. We didn't have an MRI. Rehab didn't exist. I mean, and none of that happened immediately. I mean, I've been very fortunate. I don't know if you noticed at the county commission meeting, we had the only 3 board chairmen that I've worked for here: Arnie Kempton that hired me, Isabel Kempton, and Dr. Gunther, and all 3 of them have been really good leaders and do what's in the best interest of both the employees, but in particular the patients we serve, the community. So I think we've come a long way, and the thing in this industry is you can't just rest on your laurels. You can't say, okay, we changed some things, now we'll just ride out into the sunset, because with healthcare reform, the rules change in the game. And that's part of the reasoning for signing up with Spectrum. And as you probably heard me say at the commission meeting, we were the only remaining independent hospital in West Central Michigan prior to the approval of the commissioners. So there's a reason for that when you're looking for bench strength and capital and ways to maximize purchasing and negotiating third-party payer contracts and all that. So so far so good, but I think we're ready to go to that next level now.
Yeah. And kind of expanding on that, leading up to this proposed merger with Spectrum, what was and specifically since 2005, when you say that turning point took place, what is the perception of the hospital? I mean, you said it's a great front entrance there with the ER and the 18 beds and the all of that. So what is the perception amongst the community now?
Well, I don't mean to be flip about this, but I'm probably not the person to ask.
Okay.
I'm hoping that the community would say, we're proud of our local hospital. We've watched it improve over the years. We're proud of the fact that we, meaning the community, was able to assist in helping get them over the hump, so to speak. There's a long history here of the hospital had hit a wall a number of times. You heard that mentioned in some of the meetings. Mm-hmm. And each time the hospitals had to reach out to the community. That's part of the merger thing as well. How many times do you go back to your community in a very difficult economic period? That's these stars not lining up, so you have to look at other sources. And I go back to healthcare reform. The rules of the game are changing as well. I would like to think that the community feels that the perception has improved, the quality has improved, that we have a good medical staff, that the personal touch by our employees is something we believe in and will continue, won't have anything to do with the merger. I've been quoted many times saying the personal touch is just that, it's personal, and shame on us if we lose it, because it's up to us to carry that feeling and that culture. And I use the example in Reed City. They talk about a legacy of hometown care close to home. The Spectrum merger only enhanced that. It gave them tools that they could still have that local feel. And when we expand the cancer center there, it means instead of driving to Grand Rapids, you can get that there. Same thing hopefully will happen here. It's not that you're going to take patients out of the community or physicians, because we're not. Spectrum wants your facility to be strong and vibrant and do really well. And the things they do well, yes, they would be interested in. Heart transplants, lung transplants, open heart surgery, brain surgery, etc. We don't do those here, and we probably shouldn't. So it could work very well at this point.
Okay, and that kind of led into my next question there. With the merger on the horizon here, how will that further, improve the view of the hospital within the community, in providing that quality care, and as well as possible new services?
It's not something that's going to happen on a dime. It's going to take a while. As I said, we're going into the Spectrum merger in a position of strength. A lot of hospitals don't. They're teetering on the edge. They say, come rescue us and help us. We are not one of those. We're one that's done very well. But at the same time, our trustees said, with healthcare changing, what can we do to ensure the hospital's here for the foreseeable future? We think that the merger with Spectrum, number one, right out of the chute, it is going to give us better buying power. We're going to be buying with the whole system. It's going to give us better rates on third-party contracts. When we go to negotiate what Blue Cross or Priority Health pays us, then it's going to be based on the covered lives in the whole system, not just, right now we negotiate on our own, and so we'll be in a much better position in that regard. It's going to give us the opportunity to bring more specialists here that we need, things like dermatology, urology, oncology. We have bits and pieces of that now, but maybe more on a full-time basis. Expanded cardiology. There's a couple of terms that's been used in our merger journey, and intellectual capital is one thing. Accountants, architects, engineers, master planners, etc., that they have on board that we currently pay out of pocket for whenever we use those services. And then bench strength. Whenever we want to look at a market to see how much market share we are capturing or what we need to do different, better, they have an entire department that deals with that very thing, that we would have to pay for those services. I think there's also this connection, we've talked about it some. Our patients tend to go south on 131 for their tertiary care that we don't provide. And I think the fact that they know we're in a system with Spectrum helps with the transfer of their records, that everything is consistent, the quality's the same here as it would be there, the perception there, it's a top 10 health system of the United States. It's kind of like being part of the Mayo Clinic or Cleveland Clinic or something. We're part of Spectrum Health. That's a badge of honor. Yeah. So I'm hoping that the community looks at it that way, and we feel that's what they're going to bring to the table as well.
Okay. And so with the Spectrum's board approving the merger, the hospital board approving the merger, and the county board approving the merger, all we're waiting on right now is approval from the federal government.
Correct.
And they're looking at the physicians' contracts. When and if that does happen, which I wouldn't see why it wouldn't, is it finalized at that point as soon as they give the go-ahead, or what
I think it would be very soon after. Right now, we're all anticipating that will be done by calendar year end, by the end of December. Yeah. When that's done, then there needs to be some official work done, actual signing of agreements that have been approved, like the resolution that Mr. O'Neill read last night at the commission meeting. I would say if it's late December, Spectrum may want to wait till February 1st, March 1st in order to make it happen. But you're right, it could be very soon thereafter. It will not be on the spot. If the federal government calls and says, okay, we finished review, everything's fine, there'll be a little more due diligence that needs to be done, just tying up loose ends and stuff. But no more votes. Votes have all occurred.
Okay. So at that point, it will be go-ahead, will be for sure thing, just need to finalize some of the...
Yeah, and if I was real specific, I would say there's a real good chance it could be January 1. And if it's not January 1, even a better chance it would be March 1. I don't see it going beyond March at this point for the reasons that we talked about. Now, if something comes out of the woodwork where the government's just the government and it's slow, and we get to March and they haven't finished, we're still in a position we could go without that being finalized. We're trying to do this by the book and let them finish their review. We know there are no issues. They've had a cursory review, and then there's some more levels that's got to go through. So that would be a Spectrum decision at that point. Right now, all the authorities' levels have been approved to proceed with this.
Okay.